Hello, my name is Cynthia Thomson. I'm a professor in health promotion sciences at the Mel and Enid Zuckerman College of Public Health at the University of Arizona. I'm here today to talk to you about cancer transitions, living well through healthy lifestyle, skills, and habits. Other key modifiable risk factors influencing colorectal cancer and its survival are physical activity and diet. The American Cancer Society 2020 Cancer Prevention Guidelines for diet and physical activity ask us to achieve and maintain that body weight, but also to be physically active, follow a healthy eating pattern at all ages, and it's best not to drink alcohol. So what about physical activity in colorectal cancer? What we know is less time in sedentary activities like sitting or on the screen or laying around is associated with lower risk. So less time in those activities is what we're trying to achieve. Greater time in moderate to vigorous activity is protective. Data are lacking for strength building activities, but we think that because strength training activities increase muscle mass and reduce the risk for sarcopenia, as we mentioned earlier, it is likely to improve outcomes after cancer. Minimal data specific to populations is available, but we think this probably holds true across races and ethnicities, and in fact may be even more important to older individuals who, by virtue of aging, may reduce their lean mass. 47% of US adults do not meet recommendations for physical activity. And unfortunately, for colorectal cancer survivors, these numbers are about the same. Now we know in looking at plots of survival that physical activity is associated with protection in terms of reducing mortality. Both pre-diagnosis and post-diagnosis data suggest there is a protective effect. If you look at this graph, where the dotted line coming down vertically lies at 1.0 suggests no association. But every arrow to the left or bar to the left of that number 1 suggests a protective effect. And so what you can see in the bottom left area is that the majority of studies that have looked at colorectal cancer survival and physical activity have shown that physical activity matters. Possibly a 45% greater survival among active adults. Inactivity has also been associated with early onset colorectal cancer, and these are data from the Nurses' Health Study, where sedentary time, only 14 hours a week, is associated with a 70% higher risk for early onset colorectal cancer. We don't have the data yet on survival, but we would expect that being active and avoiding inactivity are important to survival as well. So how does physical activity reduce cancer risk? And I list for you here several different mechanisms, from reducing our stress to reducing the amount of time stool is in our gut, to improving our metabolic health, to reducing inflammation and promoting weight control. Diet is another factor that is extremely important to colorectal cancer risk and survival. It's important to know that higher risk is associated with higher intake of red meat, processed meat, and lifetime alcohol intake, whereas lower risk, and this is both for disease as well as survival benefits, is to eat a diet that demonstrates a healthy eating pattern that has lots of vegetables that are non-starchy, whole fruits, dietary calcium, and anti-inflammatory foods. We know that processed meats, particularly maybe early life exposures or lifelong exposures to some of the global dietary changes that started in the 1950s, may be driving colorectal cancer risk, particularly for early onset disease. We know that our diets have become increasingly more processed. We have more intake of refined grains versus whole grains, And we had a period where there was very high intake of high fructose corn syrup in the products such as sugar sweetened beverages. There also are some protective nutrients we want to pay attention to: calcium, vitamin D, fiber, and polyphenols. Have your diet evaluated, perhaps through a meeting with a registered dietitian, to determine if you're getting enough of these nutrients in your diet to promote health and well-being. Also, make sure that you eat a diet that is not Western-like, but rather prudent or Mediterranean-like, because we know that these diet patterns either increase risk, as is the case with the Western diet, or protect against adenomas, the precancerous lesions, as we've seen with the Mediterranean and prudent diets. Here again, I'm showing you a bar graph, and what you find is that everything below 1 suggests a protective effect. So here we have 5 different cohorts: AARP females, the multi-ethnic cohort females, the Women's Health Initiative females, the AARP males, and the multi-ethnic cohort males. And pretty much across the board, when you eat a diet that is either the Healthy Eating Index, the Alternate Healthy Eating Index, or Mediterranean, or DASH, which was a diet high in plant foods that was designed to reduce blood pressure, all of these healthy eating patterns are protective in terms of cancer mortality. And data suggests that they are even more protective for colorectal cancer than most cancers. Red and processed meat, remember, there are a number of mechanisms by which these food groups can drive cancer risk. And I list several of them here for you. But I want to point out in the green box that it's not just the food, it's also the way we cook the foods. Because when we char foods or cook them in dry, high heat, we produce compounds that are associated with higher cancer risk. Things like our polycyclic aromatic hydrocarbons, the heterocyclic aromatic amines, and the advanced glycogen end products, or AGEs. These compounds come in contact with our gut, and our gut mucosa will then become inflamed. We can also see that there's a higher level of cytokine, or those inflammatory compounds produced with these exposures. And not only can these affect the gut, but the gut's health affects our overall systemic health as well.